Hey everybody, Dr. Kimball here. About to talk to you about something that is really common in spine and in patients that have back or leg pain problems. So as we age, and we've done another video on kind of the aging process in the spine, one of the most common things that happens to your spine is it develops something called spinal stenosis. This word stenosis is just our word that we use in medicine to describe narrowing of a space or a channel in the body. It could be in your heart, could be anywhere, but when it happens in the spine, we call it spinal stenosis. So I'm going to tell you a little bit about what spinal stenosis looks like when you're a patient. People can develop usually symptoms consistent with compression of some sort of nerve, pain down the leg. They can also have concurrent back pain. When you have stenosis of the spine or compression of the spinal canal, and right now we're talking about spinal stenosis in the low back, it will typically cause patients to have more pain in the legs or weakness in the legs when they're standing upright, okay, or laying flat on their back. Any type of extended posture is going to accentuate the amount of tightness in the spinal canal, okay? So knowing that to start, if you're having problems like walking long distances, your legs start to ache, or you have pain down one leg when you're walking, you may have some element of spinal stenosis. Patients that have these symptoms tend to want to hunch over or lean over. And so over time, as they're walking or throughout the day, they may start standing upright, but as the day goes on, they really end up kind of walking and looking like an old man. And that's what their spouses will complain of. It looks like he's older than he really is. Well, if that's happening, there's a good chance you have spinal stenosis. So this is a little model of the spine. There's three things that cause spinal stenosis, okay? One, you can have bulging of the disc as the spine compresses and you have, our friend gravity working on us, the disc will start to bulge out. And then there's these facet complex on each side of the spine that they hypertrophy or they enlarge. The example that I like to give my patients is when you're young and you were playing football or whatever and you jammed your finger, you know that it's swelled up a little bit and that's a sort of trauma. Well, these joints are very similar in the spine. When they're traumatized either through just wear and tear, aging, or some sort of traumatic event, those joints will inflame and reactively enlarge. And as they enlarge, they grow out and they also grow into the spinal canal. So there's a joint on each side of the spine. They grow into the spinal canal and they contribute to that stenosis. So you really get this trifecta, which is disc bulging, facet joint on one side, facet joint on the other side, and then concentric narrowing of the spinal canal. The end result is the nerves have much less space to get past that level in the spine. And then you end up with aching and or weakness, throbbing in the lower extremities, and even shooting pain down the legs. Some people will not have any pain at all. They'll just feel like their legs are weak. I'll tell you, that's not normal. It's not a normal sign of aging, and it is likely a symptom or a sign that you're starting to have symptoms that would be related to nerve root compression in your spine. So lots of different treatment options, therapy, injections, anti-inflammatory medication. When the stenosis is so severe, I like to look at it like a real estate problem. There's no medication, there's no injection, there's no therapy that's actually going to make more room for your nerves, and they're really just screaming, begging for additional space. When that happens and you're becoming less functional because you can't get around, you definitely need to see a surgeon, talk to them about it, look at the MRI scan. I'll do another video on this to kind of give you a little more insight and also show you a couple cases and the MRI imaging and X-ray imaging that you would see with spinal stenosis. There's a bunch of different variations of it. So again, like I've said in my previous videos, every patient is totally different. The anatomy from one person to another is totally different, and the treatment option may be totally different. The one good thing about stenosis is the majority of the time, if that is your primary problem, it can be treated without any sort of fusion surgery. So dime-sized incision, same-day surgery, hour-long procedure. A lot of times this can be fixed very simply, and that's always a good thing because as you know, I like to avoid changing the biomechanics of the spine, and I like to avoid fusing the spine. So anything related to minimally invasive, motion sparing surgery, that's right up my alley. And the end point and end goal is to get you more mobile and keep you active. So hope that was helpful. Thanks.